So I was actually asked to talk about remdesivir, which is the new coronavirus drug put out by Gilead Sciences. One of the issues with that is that there's not a lot of data being put out on that drug that's not heavily in favor of the drug, which is partly due to the process that the FDA is using to get that drug approved for coronavirus. The other issue is that, again, I'm on satellite internet, so for me to do any kind of research requires quite a bit of effort because of download times. So instead of starting with that drug, I thought I would actually go over another drug which people have asked me about, and that's hydroxychloroquine. Hydroxychloroquine is the drug that was mentioned almost about a month ago by our esteemed president and some other scientists as a possible treatment for coronavirus. It was met pretty abruptly by the scientific community with a please don't do that caution. Continued on in the news media, and the result was that a lot of people had a lot of questions about why the heart arrhythmia things that people were talking about in the media could affect them and why that was such a bad thing in relation to the coronavirus. So just to kind of go over a few things, the hydroxychloroquine is part of a group of drugs called the quinines, and they historically were used to treat malaria. If you look at the old descriptions of malaria drugs, they apparently taste absolutely disgusting, but they were useful in helping prevent malaria, which is a parasite type of infection in humans, and it used to be one of the leading things that killed the British explorers as they went about colonizing the world. So that's where those drugs come from. We don't really use them for malaria treatment anymore. We have other medications that we use, but we do use them in people who have autoimmune diseases. They are not first-line autoimmune disease treatments. We have a lot of other drugs that are a little bit more precise in how they work. So when I see a patient on hydrochloroquine or Plaquenil, it raises a lot of red flags for me. It tells me, one, that they've probably not done well, or what we've called failed, their other drug treatments. And it also raises red flags because I know that this drug has very serious side effects. One of the side effects of this drug, I'm just going to get it out of the way, is something called Stevens-Johnson syndrome. This is an attempt by your skin, and it's, again, kind of I think it's autoimmune related, to pretend that you're a lizard, and you literally just slough your skin off. It's almost like degloving. A degloving injury is one that we see in the operating room where literally, it's usually on the hand or the arm, and it's usually related to motorcycle collisions where they weren't wearing adequate gear, or to mechanical things where somebody got their hand or arm partly stuck in machinery, and it just strips the skin off right down to the tissue, the muscle and bone tissues underneath. These are really gross injuries to see. I don't really get too squeamish in the OR, but these are one of those ones where I have to kind of look away and then look back because they're pretty gruesome. Stevens-Johnson isn't quite as all the way down to the bottom of the skin, but it's all the skin layer coming off at once. Lizards are meant to do this. You know, they've evolved to do this. Get rid of the skin, get a new fresh layer of skin on. Humans, not so much. So when all of your skin down to the bottom levels decides to come off at once, it's not something you always survive. And as you can imagine, it would be a pretty horrible, painful complication and possible lead to your death. So that's one side effect of the hydroxychloroquine. The other side effect that has been in the news media is this thing called long QT syndrome and this fancy word that we use in medicine called torsades de pointes, or TDP. So this is a special type of heart arrhythmia that is oftentimes related to lower chamber or electrical issues into the lower chamber of your heart that causes a type of arrhythmia that makes your bottom chamber not be able to pump. So just to kind of go over why everyone has to worry about this, because I guess the big thing I've heard from people is, well, I don't have coronary artery disease, I don't have congestive heart failure, I should be able to have this drug if I need it for the virus treatment. The problem is that you don't have to have coronary artery disease or congestive heart failure to have a drug like this induce long QT syndrome on you and stop your heart. Okay, you can be otherwise, as far as you're concerned, young and healthy, and this drug can just kill you flat. So one of the things that people sometimes don't really understand is how their heart works very well. And my job as an anesthesiologist a lot of the times is to end up explaining things to people in the preoperative period, which is not the most ideal time, but explaining things to people in a way that hopefully they can understand, so they can understand either the surgery or their physiology a little bit better. I will mention that by the time I'm translating something medical to you, it's probably already been down translated to me by another physician who specializes in that. In this case, my cardiologist. If you're a cardiologist, by the way, don't watch this, because this explanation of how the heart works and how this drug can affect your heart will probably drive you crazy. So anyway, so the cardiologist down translates a complicated scenario for the heart, and then I down translate that to the patient. It's kind of like if you were at a restaurant, the chef sits there and tells the waiter, hey, you're gonna get a ravioli stuffed with truffles that were hunted in the high Alps of Italy with a pig, and it's going to be marinated in butter made from cows that have only been fed clover, and this is what he's selling to the waiter. The waiter then comes to you, which is me, and says, you are going to get a delicious mushroom ravioli today, ma'am. And I go, excellent. And then I turn over to you, my dinner companion, and I go, hey, do you want some pasta? That's kind of the level of down translation that sort of happens in medicine. So how your heart works is, first off, like most people are aware of, you have a right side of your heart and a left side of your heart, and each of those sides are split into two chambers. We're gonna kind of ignore the right side of the heart for right now. The right side of your heart is kind of more often talked about in relation to slow cardiac death, so like a congestive heart failure. It's less common that the right side of your heart stops working and you just immediately die. Usually it's kind of like a slow progressive thing. Unless you're talking about a PE, that's a good fast way to kill you with right-sided heart failure, because it just blocks off the entire exit for the right side of the heart. For the most part, though, right-sided heart problems and the electrical issues with them are kind of chronic, ongoing things. The left side of the heart is where you're actually pumping blood. The left side of the heart's main deal and how it largely is controlled is through two electrical circuits, discharge places in the heart, one for the top chamber, one for the bottom chamber. And then while it is set on a constant mechanical pump setting, the brain actually does a lot of the control because it decides how much oxygen and blood it wants. It does a lot of sub-control of those electrical circuits. So left side of the heart, upper chamber and lower chamber. And they are driven, it's a pump, but it's driven by timed electrical circuits. So your entire body, just so you know, is kind of built like a house, right? So you have plumbing, that's your circulatory system. You have electricity, that's your nervous system, all right? So your electrical wiring. You've got framework, so that's everything that kind of holds the house up and together. That's your connective tissues, your bones. And then you have individual appliances, which are your organs that have been designed to do certain things. I often think of the heart as the furnace of the body. It makes sure that you get the hot water heated going. So your hot water heater is in charge of, in my mind, making sure that your circulation is warm, which is what most of us want. It's also really, in this case, in charge of making sure that your lungs are getting oxygen to your blood, so it's priming your blood full of oxygen. Your heart is the thing that moves blood through the lungs to get oxygen, okay? You can kind of give other appliance designations to other organs. I oftentimes think of the liver as like a refrigerator. The brain is kind of like one of those really fancy systems where you can control everything in your entire place just from your iPhone. So anyway, so the heart is the furnace. It's pretty much a mechanical pump, but it requires very precise electrical orders for it to work properly. So on the left side of your heart, you have, like I said, two chambers. Your heart is designed in such a way that for the most part, the upper chamber helps out, but it's not as necessary. So when you hear people who have AFib and stuff, it's just an upper chamber problem. So what happens when you do your electrical circuit is you get the top chamber squeezes into the bottom, and then the bottom chamber squeezes the blood out, right? And maybe you do that a few times, top, bottom, top, bottom. It's more complicated than that though, in reality. So what also happens is you get top, bottom, but then you get top, bottom, and it actually squeezes. The squeezing motion is what really makes the blood flow. In order to have squeezing, and to get that blood like you're wringing out a towel, except that your heart actually does that, it wrings itself out, you have to have it be organized. You can't just squeeze the top and the bottom at the same time. You have to squeeze the top and then the bottom, okay? And that's how your heart works, and that's its most efficient way of working. So now we get back to the hydroxychloroquine. So what it does is it interferes, or it elongates. It makes it longer between when you get the electrical signal. Here's the electrical signal, and then you pump. So you discharge, pump, discharge, pump, discharge, pump, discharge, pump. And that's kind of what your body does. What it does is it lengthens out the space between the discharge and the pump of that lower chamber. So you get discharge, pump, discharge, pump, instead of discharge, pump, discharge, pump. So it lengthens the space between that. For the most part, for most people, that still works just fine, and it's not really an issue, and your body can accommodate the fact that there's a little bit of a lapse between when the electrical signal happens and when the pump actually performs. When you start having issues though, like congestive heart failure, coronary artery disease, you're born with weird electrical wiring, okay? All of us are born with a brand new house built in a brand new subdivision. And all those walls, when we walk into that brand new house, are already walled up. We don't know what's behind them, but we assume everything's up to code. Sometimes it's not really up to code. Sometimes the electricians put wires in one place and then decided they actually didn't like them there and moved some wires around, but then just left those ones but didn't have any electricity going through them. But maybe they're still live wires, maybe they still aren't. The issue is that the older the house gets, the more problems you start getting behind the walls, right? When we go to surgery, we're tearing the walls off. We're trying to find out what the problem is with the plumbing and the electrical, and then we're putting the walls back together, and hopefully we fixed all the maintenance issues. The older your house gets, the more maintenance issues you're gonna have. So age is an issue. Where heart arrhythmia, things like long QT are concerned, for some reason women are at higher risk than men for these. And some medications cause long QT. So you can be born with electrical issues. You can start outliving the useful circuitry that was put in your house. And you can start developing plumbing issues that maybe make it harder for the furnace to work. And if the furnace finds it harder to work, it might start spacing out its pumping a little bit. So what happens with long QT, like I said, is you get the discharge and then the pump comes a little later. And then you get the discharge, and then maybe the pump comes even later, and then you discharge, and then the pump comes even later, and then eventually what happens is you have a discharge, and maybe the pump is so late it doesn't actually have time to go again, so it skips a beat. It skips a pump out. Skipping a pump completely and just waiting for the next discharge to go again is something that actually most people's hearts do every now and then. Everyone skips a beat occasionally. As long as you skip the beat completely and the pump doesn't try to work in that space, it's fine. What happens is when you discharge and then you try to pump, but then you discharge again while the pump is still working, that's when there's problems, okay? And long QT, because you've started spacing that out and you get it spaced out so far that eventually it's pumping right when you're also trying to initiate a new discharge, you can get that pump confused and it can basically clamp down. Clamps down, it can't open to accept more blood and it can't expel more blood. Sometimes it even kind of quivers, okay? That's not an effective pumping motion either. This is times like this where you see us get out the shock pads and we try to reset the rhythm of the heart, okay? Things like long QT though, if they're an intrinsic issue, meaning if it already exists from a drug, it means you're prone to doing that even if we reset your heart, because we're not resetting your heart so that you go pump, squeeze, pump, squeeze. That's not what we're doing. We're resetting it so that we're going right back to the same problems we already had before. This particular drug causes that problem, okay? So it causes the elongation between the signal that you need to pump and when you actually squeeze down. So that signal gets longer and longer, and eventually your pump might seize. It can't work at all, okay? Once it seizes up, it's really hard to get it going again. So this is an abrupt and severe heart attack or cardiac death, okay? That's why we worry about this drug. And again, it doesn't matter if you have some of these other heart conditions. They certainly can make things worse, but you can be young and healthy and just be prone with your electrical circuitry towards having this. Okay, there's not a lot of ways for us to get you back from this kind of cardiac death, and that's why it's so serious. And we don't just give this drug out to everyone, and you have to have a lot of monitoring, including EKGs, that you have to see your doctor for if you're going to be on this drug just for autoimmune diseases. Anyway, I hope that helps you understand a little bit just how that drug interferes with your heart. Again, you know, we always say in the operating room, you can't cure stupid. You can't, because people do stupid things. But you can cure misinformation and disinformation. So I just want people to understand a little bit better about why this drug is dangerous and why anyone really can be susceptible to it. Again, any questions, feel free to email me. I have satellite internet, so really hard for me to get back to people. And hopefully in a week or so, I'll be able to get something together for you about that antiviral drug. Anyway, in the meantime, it's Dr. Collins signing off. Behave yourself.